Our project is biodegradable zinc implants for intra-articular fractures. My name is Michelle.
I'm Nithya.
I'm Delaney.
And I'm Anjum, and this is our value proposition.
So the problem we aim to address is intra-articular fractures in the ankle. These can be seen in the images to the left, which often require surgical intervention with permanent implants and revision surgeries. The secondary surgeries increase the risk of infection by a significant amount, and the cost of additional surgeries is significant to the patient. Therefore, there's a need to minimize complications, additional surgeries, and infection rates. There's about 187 per 100,000 adults with ankle fractures every year, and of these fractures, 84% of them have intra-articular pathology, meaning that the fracture crosses the ankle joint. So our design leads to limit the infection rates while lowering the cost of treatment, and our target audience is medical professionals and patients with intra-articular ankle fractures, which would likely be elderly patients due to weaker bones and higher likelihood to sustain this type of fracture.
The material for our device would be a zinc magnesium calcium alloy for the H plate and screws. This would promote corrosion resistance and osteogenic properties. The coating would be beta tricalcium phosphate, TCP, which would also improve osseointegration and osteogenic properties. On the right, you could see our model for our device. For the fabrication process, we would use personalized patient imaging data such as CT or MRI scans. This would lead into a CAD software data model of the implant and then the slice model data. We would also use selective laser melting for the material and 3D printing, as well as finishing off the device with surface coating of TCP.
When comparing the costs of current designs versus our design, it is important to go over what the current designs are. So first, closed reduction and percutaneous pinning, CRPP, is minimally invasive and it achieves fixation with minimal tissue reduction. This method is used for simple fracture patterns, but it is not the most stable since there could be pin migration and a limitation of motion. Open reduction and internal fixation, ORIF, is through open surgery where bone is realigned with screws, plates, and rods to introduce stabilization. And this method is usually used when a break is to the point that the fracture has pierced the skin. A similar method of implantation will be used for our zinc implant design. Lastly, external fixation involves a semi-rigid external metal frame and percutaneous pins that go through the bone to stabilize. This has to be removed once healed, and this method is usually used for open or infected fractures. These practices range from $19,000 to $22,000 for uncomplicated cases, but when complications arise, additional surgeries are needed. For our design, the cost of the zinc implant itself will be 3 to 4 times more expensive, but due to it degrading over time, there is no need for additional costly surgeries. Leading into the benefits of our design, first, the degradation of the zinc plate and screws will allow time for healing tissues with no need of removal once healed. Since there is no need for removal, there is a lower possibility of infection. And lastly, since the procedure will follow a similar ORIF process, it will be completely internal, so external fixtures that cause obstructions, such as those present in CRPP and EF, will not be present.
The current standard implants are primarily permanent, non-biodegradable metallic implants. However, these implants present significant drawbacks. Titanium implants often fail to bond chemically with bone tissue, leading to weak osseointegration and potential risks of inflammation and toxicity. Stainless steel implants can induce bone resorption due to stress shielding caused by their higher stiffness compared to human bone and may provoke inflammatory responses. Cobalt chromium implants with their high nickel content possess allergy risks and exhibit low biocompatibility with host tissues. Our solution addresses these limitations through a biodegradable implant design that gradually dissolves over time, mitigating stress shielding effects. The corrosion byproducts of our implant, primarily zinc hydroxide, are biocompatible. Leveraging zinc alloys with osteoinductive properties, comparable mechanical strength to titanium, and optimal degradation rates, our design offers a promising solution to the shortcomings of current standard implants. And these are our references. Thank you.